Hey everyone, today we are going to cover lung cancer. So it's the leading cause of cancer death in the US. So let's break down everything you need to know. So lung cancer accounts for almost a quarter of all cancer-related deaths in the US. So the biggest risk factor is smoking. Smoking is responsible for 80 to 90% of all cases. So lung cancer divides into two main types: small cell lung cancer and non-small cell lung cancer. So small cell lung cancer is aggressive, grows rapidly, and metastasizes early and is strongly associated with paraneoplastic syndromes. So it's typically centrally located, whereas non-small cell lung cancer accounts for about 85% of lung cancers and includes multiple subtypes, mainly adenocarcinoma and squamous cell carcinoma. So here is the challenge. Early lung cancer stage is usually asymptomatic. It's often discovered incidentally when a pulmonary nodule shows up on imaging when it's done for another reason. So later stage disease presents with pulmonary symptoms like hemoptysis, cough, dyspnea, and chest pain. Whereas extrapulmonary symptoms include fatigue, bone pain, weight loss, and you should watch for paraneoplastic syndromes, SIADH causing hyponatremia or hypercalcemia from PTHRP secretion. So lung cancer frequently metastasizes in brain, adrenal glands, liver, and bones. So SIADH full form is syndrome of inappropriate antidiuretic hormone secretion, whereas PTHRP is the full form of it is parathyroid hormone-related protein. So diagnosis: the evaluation starts with CT imaging for the chest to characterize any nodules and assess for lymph node involvement. So diagnosis is confirmed with tissue biopsy, either bronchoscopic biopsy for central lesion or CT-guided needle biopsy for peripheral lesions. So once diagnosed, staging is crucial. So PET-CT helps identify distant metastasis, and brain MRI checks for brain mets, and the stage determines the treatment options and prognosis. So treatment depends on stage and type. For early stage disease with no distant metastasis, curative surgical resection is the goal. Lobectomy or pneumonectomy depending on tumor location. So surgery may be combined with adjuvant chemotherapy for patients who aren't surgical candidates. Definitive radiation therapy or stereotactic body radiotherapy can be used. Unfortunately, most patients present with metastatic disease and aren't eligible for curative resection. So these patients receive palliative treatment, chemotherapy, radiation, targeted therapy for specific mutations like EGFR or ALK, or immunotherapy with checkpoint inhibitors. Prognosis and prevention. So prognosis is generally poor, and overall 5-year survival rate is below 20%. So this varies significantly by stage. So early stage localized disease has much better survival than metastatic disease. So prevention is crucial. So smoking cessation in the stage in single most is the single most important intervention for high risk individuals, heavy smokers aged between 50 to 80. Annual low dose CT screening can detect lung cancer early when it's most treatable. So hope you find this helpful. If you found this helpful, please hit that like button and subscribe to my YouTube channel.